Thank you so much for waiting, and thank you so much for your patience, and thank you so much for joining us. We're going to go ahead and get started. It looks like we have a nice full room, which is great, and I'm sure if anybody else jumps on, they can get caught up. So a couple things I want to mention really quickly is we will try to answer questions. We'll try to keep it to about an hour because I know that that's what we're doing a 1 CE credit for an hour, and so we'll try to keep it to about an hour to observe your schedules. But if you do have questions, please ask. Use the Q&A. So if we aren't able to get to your question live, we will at least have them recorded, and we'll be able to either email you an answer back, but we will try to get to your question live. Make sure to stay on to the end. We do have, I'd love to tell you about our digital platform, and then also I can talk a little bit about how you'll be receiving your CE credit. But before I get started, I'd like to let you know who we have on board to talk with you tonight. So you guys are actually really lucky because we have our CEO and President, Leslie Stevens, who is going to be giving our presentation tonight. I'll tell you a little bit about Leslie. She's actually a mother of 3. Her goal and desire is to provide every advantage for children to allow them to live healthy and happy lives. As you know, there is a silent epidemic affecting 9 out of 10 children, and this epidemic manifests itself in a variety of symptoms that can be easily overlooked, misdiagnosed, and most unfortunately left untreated. So it's critical that children are evaluated for sleep and breathing habits. And Leslie is not only our fearless leader, but she actually lectures and she trains all over the world. I don't think there's a question out there in reference to the subject of pediatric sleep, breathing, airway, and HealthyStart's connection that she cannot answer. And when you have the backing of a company like HealthyStart by Orthodontists with 51 years, over 4 million cases, I mean, she definitely has the research to back her up, so which is fantastic. Leslie's mission is to educate both parents and oral physicians to ensure children a lifetime of health, happiness, and success. So I am actually going to hand the screen and the mic and everything over to Leslie, and she is going to get started on the presentation.
Well, thank you so much, Susie. I am delighted to be here tonight, and I am looking forward to a wonderful educational hour of learning about airway, learning about breathing, sleeping, and most importantly, our pediatric patients. So I'm pleased and honored that you've joined us tonight, and let's get started. This is one of my favorite presentations. I always like to hear from doctors and how amazed they are to hear about what we have to talk about and realize how pertinent this is in their practice. So anyway, so this evening we're going to talk a little about HealthyStart, sleep disorder breathing. Sometimes it's referred to as sleep-related breathing disorders. Same name, it means the same thing, just slightly different verbiage. So we're going to talk about sleep issues, breathing issues, airway issues, and how basically we can identify them, how we can address them. So let's start off the night with how do we identify? How can a parent identify what's going on, or maybe some health problems that they maybe don't realize that their children are exhibiting? So we have a list of 27 different items that are outward symptoms of sleep. And these items include ADD, ADHD behaviors, bedwetting, difficulty in school, especially in the areas of math, science, and spelling, mouth breathing, snoring, restless sleep, delayed or stunted growth, nightmares or night terrors, irritability, anger, morning headaches, chronic allergies, eczema, asthma, depression, tooth grinding, swollen adenoids and tonsils, aggressive behavior, daytime drowsiness, peer problems, few friends, frequently wakes up at night, possibly sleep talks, maybe even sleepwalks. But what's really critical is to understand basically how many kids are affected. Do you realize 9 out of 10 children exhibit one or more of these outward symptoms? I would call that more of an epidemic than I would call it a condition. So I want to stress how important it is to realize how many kids are affected and how pertinent it is. So every time you're looking at a patient, especially a pediatric patient that walks into your office, you need to look at the signs because more likely than not, a child will be exhibiting these outward symptoms. So what do parents do when they see a lot of these outward symptoms? Unfortunately, parents tend to look at them individually. So for instance, a child has asthma, we'll go see an allergist. If a child has ADD and ADHD, they might see a social worker or a psychiatrist. And what do these doctors do for those conditions? Well, they can offer them drugs of all varieties, prescription drugs, maybe testing, psychiatric testing, counseling, therapy, surgery, sleep studies. There's a whole variety. And we look at these different possible remedies for individual outward symptoms. And the problem is these are addressing it's only addressing the symptoms and not the root cause. These variety of solutions are really short-term Band-Aids. Many times the diagnosis involves several drugs and unfortunately with many side effects. And obviously they can be costly, painful, time-consuming, and ineffective. Well, unfortunately, doctors don't realize that maybe those individual outward symptoms that we're identifying and treating with a Band-Aid solution really are related to each other. And the question is, how do they relate? What is basically the underlying root cause that is basically portraying outward symptoms? So these underlying root causes include mouth breathing, narrow palate, improper tongue placement, and improper jaw relations. So currently, dental professionals actually have the knowledge and the tools to impact the development of a child's airway, to increase the oxygen intake and reduce carbon dioxide buildup. So right now, it's so much more, far more than cavities. It's so much more than straight teeth. It's basically looking at a child and addressing their overall future health and their well-being. So tonight, I want to go through a little bit, and I want you to end up tonight kind of having a better idea about identifying sleep disorder breathing symptoms, being able to evaluate these symptoms, understand and identify the root cause, diagnose the problem, and obviously treat. So as your patients walk into your office, I want you to start looking at them differently. I want you to look at their entire physique. I want to look at their overall health, not just their teeth. So look at the girl on the left. Obviously, she looks exhausted, but look at the circles under her eyes. Is her head lurched forward? Look at the boy, same. Look at how his lips are parted. Do you think he mouth breathes? Probably. Look at him. He looks a little bit heavy, but he's not heavy. That lower chin is actually in a retrusive position that makes it look like he's heavier than he really is. How about the profile of the child? That can tell you so much. Look at the profile of the girl on the left. How deficient is she in the lower third? Look at that retrusive mandible. Is she a mouth breather? Absolutely. Look at the lips parted. Look at how the lip rolls. This girl also, a lip roll. Look at the profile. We tend to call this kind of neck position a funnel. There's little definition between the chin and the neck. It's almost diagonal that goes, the chin blends into the neck. We look at where the position, we look at the circles under their eyes. We take a look at all these features, and we want to kind of in our mind realize what the root causes are. So let's go through that again and kind of pinpoint maybe visuals before we even have the child open their mouth. So we're going to look at mouth breathing, allowing the mandible and the tongue to displace, causing a reduced airway and air exchange to the lungs. Habits like finger sucking, abnormal tongue posture, and swallowing. Look at upper arch constriction, a high palate, decreasing nasal breathing. And these items reduce REM sleep, affecting the brain function, endocrine, and immune systems. So when we talk about children, we want to talk about their growth. The ADA has put out a policy, it was voted and approved, where they require every dentist to evaluate each and every patient, your pediatric patients, on growth and development, and airway. So when we look at this, we need to understand their growth. And let's take a look at their craniofacial growth and basically the timing. What's really kind of shocking when you look at it is a 2-year-old, a male, already has 68% of their craniofacial growth completed and 73% of females. So time is of the essence. We want to impact that child and be able to promote growth, but also direct growth, so it's growing in the proper fashion. So we tend to look at children from the ages of 2 to 12. At age 12, you can see here 89% completion of growth in the male and 94% completion of growth in the female. So game's kind of over at that point. Not to say we don't treat adults. Our oldest patient is 84 years old. However, it becomes a different treatment because we can't take advantage of growth and development if there is no more growth. We have to look at other means to help them. And we want to make our treatment, the HealthyStart treatment, as permanent as it can be. So catching a child during their growth and development allows us to make a more permanent change in that child. So as I just mentioned, the growth should be forward, down, and I want to include wide as well. So now it bodes the question, why are so many children not experiencing normal growth as well as social and personality development? Well, let's take a look at our industrialization. What have we introduced in the last 80 years that have impact? Well, we have more pacifiers, we have more bottles, we have lack of breastfeeding, we have a softer diet, and we see all of those that contribute to this deficiency in growth and development, and basically the misalignment or narrow arches. For instance, if you take a pacifier or even a bottle, the way the child holds that, it actually creates suction in the mouth, so the palate becomes narrower. At the same time, we'll look at children that come into our office and we say, wow, they have a lot of crowded teeth. Let's think about that. That orthodontic condition, obviously we want straight teeth, but more importantly, should we identify that as a potential for maybe a narrow palate? And if we have a narrow palate, what happens to the tongue? The tongue should be resting up in the upper palate during rest, as well as during a swallow. Is that occurring? More likely than not, it is not. Because what happens is the tongue doesn't have a place. It's laying low. If it lays low, guess what? Mouth breathing. More mouth breathing occurs because of that. Already the statistics show 50% of the population will be mouth breathers. And I'll tell you we'll talk about this a little further later on, but it amazes me just opening the mouth a half an inch, especially when you're sleeping, will restrict the airway by 6 millimeters. So a 7-year-old has a 7 millimeter airway. So guess what? That child is trying to breathe all night, every night, through a 1 millimeter diameter airway. Are they getting enough oxygen? More likely than not, no. What requires oxygen? REM sleep. Do you think they're getting REM sleep? No. If they don't get REM sleep, what impact does it have on the body? It affects everything. Neurological, endocrine, hormonal functions. The body is basically unbalanced. So we were just talking about pacifiers and the narrow palate. So what other clues do we have that a child might have a narrow palate? Well, if you see an open bite, usually an open bite can be bottle use, could be tongue thrust, it could be finger or thumb sucking, but basically it creates a constriction and it opens the bite. Many times we see also cross bites that occur, and crossbite is an early symptom or an early outward sign that maybe there's a sleep issue. So when we look at the airway, it's important for us to understand the nasal cavity, hard and soft palate, where the tongue is positioned. We will also talk about airway and the impact and basically the configuration of the airway. Mouth breathing, we talk about that a lot, but really we should be talking about the nose. What is the function of the nose? How important is that nose function. So let's talk about it. There's really 5 functions for the nose. The first one, it obviously serves as an air passageway. It warms and moistens inhaled air. The membrane traps dust, pollen, bacteria, and other foreign matter. It also contains receptors which sort out odors, and it aids in the quality of voice and the pronunciation of words. So typically, how many times have we seen this kind of picture? Or maybe our own child or our grandchild. This is a very typical kind of look that we see in cars, especially with children falling asleep. Is this normal? No. Is it something we should be addressing? Absolutely. And why is that? Because there is an improper air exchange to and from the lungs. The constriction, probably due to nighttime mouth breathing, was presented in a recent study of 501 and 43% of the population. So we already know basically approximately 50% will be mouth breathing. So I'm going to show you an interesting video here. This is Eli. Eli is probably about one and something. And he's in the car, but I want you to listen to what he sounds like. But I want you to see what his mother does, because this is amazing that she had figured this out. And this is something that the HealthyStart appliance does during its treatment. So here we go.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and now he's going to gulp again. There he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
Interesting, isn't it? Well, what's even more interesting is here we have a 1+ child that's already exhibiting these outward symptoms that we associate with sleep breathing issues. Do you realize that 92.6% of all of these children will not self-correct? They will remain, and 30% will get worse with age. So if you see it, address it, and address it today. Not tomorrow, but today. Because with each and every day, that child is struggling, and is struggling to get enough oxygen, but more importantly, to have the restorative sleep that they need to help with neurological development, endocrine, immune system, hormonal. These are all important areas that especially these young children during the development ages, need every bit of REM sleep in order to create the ability and the development properly that they should be receiving at this age. So we talked a little bit about airway. So On the left-hand side, you'll see a 5-year-old image of a constricted or restricted airway. Now, we already know that 21% of the population will have a constricted airway in a vertical position. The issue always is that we're only as good as our tools. So these images are obviously taken in a vertical position. However, when a child sleeps or an adult sleeps, they're in a horizontal position. And we all know that the muscles relax and the tendency for the airway to become more constricted increases. Remember, I talked to you about the mouth breathing? I'll get to that in a minute. So there's another issue that can happen. So if we see this, this is a set that we can actually determine and to see where we're having problems in the airway. This is how the airway should look. So our goal is to make a coffee stirrer look like a garden hose. Here's an interesting case that actually utilized the habit corrector, the HealthyStart habit corrector in the system. This is a 9-year-old boy, and typically the norm is when we're looking at airway, what is the average? What should we be looking for? So you take the age of the patient starting at age 5. So this boy is 9. So we would have expected his airway to be his age times 10. So it's 9 times 10 would be 90 square millimeters. Well, look at what he is. He's 53.6 square millimeters, which means that he is obviously constricted. This patient wore the first appliance in the series of the HealthyStart for 1 month. It was just the first month of wear, and they took a second CBCT scan. What is interesting is we know that an airway develops up until a child is about 17 years of age. We expect to see an adult's airway between 150 and 170 square millimeters. At age 21, our airway starts to diminish or deteriorate over time. So the question has always been, in an adult who has sleep apnea, did they ever reach that potential? Or maybe another question is that potential really significant or enough to guide a patient or an adult through life? I don't know the answer yet. We're working on it. So anyways, here is this patient that after 1 month using the HealthyStart appliance, second CBCT scan was done, and look at what their measurement was of their airway, 337. Now, that is 6 times greater than what we originally saw a month before. But what is really interesting is it possible for us to create airways that are at this level over 300 square millimeters? That would be almost double what we would anticipate in an adult. What does that say for the rest of their life? So these are the questions we're asking. We are conducting research right now to answer those questions because those are monumental. That could change everything. So I am so excited about what lies in our future and where we are going with this whole conversation. And this is just the beginning of what you're seeing right here. Okay, let's talk about a mouth breather and what that does to an airway. So you could have a child that has a normal airway, or what we consider normal right now. However, if they're a mouth breather, they're going to restrict that airway. So a 1/2 inch of mouth breathing, meaning that the mouth is separated or the teeth are separated, especially during sleep, can reduce the airway by 6 millimeters. So that's significant. That could leave a child with 1 millimeter of airway. It could be even less than that. So you can see how a child is struggling at night. And you saw that in Eli when he was sleeping. His mouth was open and that's what was occurring. So the objective is, and it's a very good illustration for parents to understand, we are not looking for a coffee stirrer of an airway. We're trying to develop it into a garden hose. So a parent can kind of see the relationship of both of them. I did an interesting study. I thought, well, if a child can sleep all night and breathe through a coffee stirrer, let me see what that feels like. So I thought I would go the whole day breathing through a coffee stirrer. Well, I think I lasted somewhere between 15 and 20 minutes. I tell you, I had the most massive headache I have ever had. I took Excedrin, I did everything. Didn't matter what I did. It did not go away. And I can only imagine the impact of breathing through something like that all night long, and what that would do to a child, what would do to their health. I mean, no one could even talk to me that day. So anyways, I bring that to your attention. Try it if you like. I'm just forewarning you, you won't feel well for the rest of the day, but it is a great visual to help parents understand the importance of obviously enough oxygen. So tonight we're talking about mouth breathing and snoring. So how did that result? What were the causes of mouth breathing and snoring? Well, it can be extended bottle feeding and pacifier use, obviously poor tongue position, abnormal swallowing, sugar processed foods, poor oral habits, thumb, finger sucking, lip sucking, tongue thrust. We've heard it all. And what do those conditions create? Well, it creates a compromised airway. So it's going to reduce the airway, it's going to restrict the airflow, reduce oxygen, increase CO2, affects the brain function. We talked about the REM sleep, immune and endocrine systems, swollen adenoids and tonsils, low tongue position, tongue thrust, underdeveloped dental arches with such conditions of overjet, open bite, and crossbite. And this compromised airway, what outward symptoms does it create for the child? Well, we'll see restless sleep, ADD, ADHD, bedwetting, chronic allergies, nightmares, daytime drowsiness, aggression, defiance, anger, difficulty in school, and frequent infections. So how do we address this? Well, we got news. We got HealthyStart. So let's talk a little bit about HealthyStart and how we're going to tackle and address all of these symptoms. Sometimes I refer to HealthyStart as a three-dimensional type of treatment because we are going to look at various underlying root causes and be able to treat them all at the same time. So tonight we're going to again talk about the root causes. So what can the HealthyStart do? Well, obviously it can expand the dental arches. You know already that half of the population will have compromised arches. And out of those, 77% can be corrected by the HealthyStart and provide the necessary expansion just with our appliances. Now, in 17.9% of those cases, possibly an adjunct appliance might be used in conjunction just because that patient needs 5 to 7 millimeters of expansion, which might be greater than where they are in their development, and being able to address that. We also, RPEs, they're used in a small fraction of the population, but these are for children that has 7 millimeters or more needed arch expansion. And again, I'm usually talking older children because there's less growth available for us to gain that expansion that we could do with the HealthyStart. Establishing nasal breathing. These appliances will prevent and eliminate the mouth breathing and encourage the nasal breathing. And again, we had talked about increasing oxygen intake, and it ensures REM sleep. Nasal breathing prepares air for optimal assimilation by the lungs. So it filters, warms, and moisturizes. We're going to train the tongue. Each habit corrector, the first appliance in the HealthyStart system, has the myofunctional therapy built into these appliances. So it's activated by a swallow. So absolutely, that exercising, that swallow is going to train the tongue. It's going to train the tongue to strengthen and condition. It's going to reposition the tongue upward in the palate. It's going to promote proper swallowing and speech. RPE prevents the tongue position, swallow, and can affect speech. So that is why we want to use an appliance that basically is conducive to promoting the proper direction and placement of the tongue, as opposed to using sometimes the Schwartz or the RPE, because obviously that's going to impact the position of the tongue and obviously impact the swallow. So it has negative side effects by using it. And it, obviously is quite invasive for especially a young child. The habit corrector will also eliminate bad habits. It will eliminate thumb sucking, tongue thrust, reverse swallow, and even open bites. Healthy Start advances the mandible to correct overjet. It increases the airway. It can correct most symptoms caused by sleep deprivation. It encourages proper facial and body growth, since lack of REM sleep impairs function of adrenal glands to secrete growth hormones. So many times you see kids that have sleep issues and they'll be very short in stature. Fortunately, when they start utilizing the Healthy Start, because we're changing the way they're breathing, we're changing the amount of oxygen, we're changing the REM sleep, we'll see a huge growth spurt in many of these children. We get reports of my child grew 4 inches in a course of 3 or 4 months. So it is relatively very quickly. And hopefully we've caught them enough so that they could regain maybe the deficiency in growth that they have been experiencing. And as I say, frosting on the cake, Healthy Start will correct most orthodontic problems. So we can correct any overbite, any overjet. We can put the teeth in the proper intercuspation. We create the perfect class 1 occlusion. We want all 28 teeth in proper place by the age 12. The fiber bundles that are developing as the teeth are erupting are actually developing into the position that Healthy Start has created. So there is basically no relapse or very little relapse, depending on the age we catch them. But think about it. We're using those fiber bundles as our retainer for life. It's ingenious. It's a great way to kind of prevent, obviously, the relapse issues that we so often see in orthodontic treatment. Obviously, as I said, reduce and eliminate future relapse. And we also reduce the chance for orthodontic treatment later. So the earlier we catch them, the more we can do and the more growth and development we can create. An interesting research study that was done, it was published at the JAOS. It was done on 501 children, and it went through basically looking at different sleep questionnaires. Healthy Start has created a sleep questionnaire that will go through and ask about 27 different outward symptoms, but it will ask a parent to rank the symptoms from 0 to 5, 5 being the most pronounced. The sleep questionnaire looks like this. Here are some of the 27. The initial means we will have a parent prior to the onset of treatment to fill out this questionnaire. We would like that same parent to then fill it out as we're progressing with treatment. Sometimes doctors use a sleep questionnaire in 3 months. We do have apps available for compliance, but also identifying and noticing the changes that have occurred from the original sleep questionnaire. So parents will identify those, and all of this will be recorded. I will also say with the app, we also take photos every Friday, so we have a record. We also ask the patient every night when they wake up, did they wear the appliance last night? Did it stay in all night? They do get 30 minutes of game time by compliance. And all of this information is accessible by the parent. It's a great marketing tool. They can show their next door neighbors, their nieces, their nephews, their sisters, their brothers. But it also is recorded in the back end of the portal for your office to identify and see the changes that are occurring in the patient. Anyways, the results of this particular study are really significant, and I just want to read through them because it is that important. Mouth breathing and snoring are commonly associated with more sleep disorder breathing symptoms than any other symptoms studied. 9 out of 10 children had 1 or more outward symptoms of sleep disorder breathing. 60% of the sample had 4 or more symptoms. 1 out of 5 children experienced bedwetting at a later age. That means that it's 18.7% of the kids will bedwet at a later age. So if you have a classroom of 20, guess what? You can expect to see about 2 to 4 children bedwetting. So it is a lot more frequent than we had originally anticipated. And obviously we don't talk about it a lot, but it's a huge detriment for a child. It kind of changes everything. Another finding was between 4 and 12 years of age, 92.6% of the symptoms did not self-correct, while 30% worsened with age. Critical statistic. So here you can see the variety of the different percentages that were studied and the percentages of incidents that were cited on the 501 cases. Mouth breathing topping the list. So we also know that if they're a mouth breather, they would expect to see 7 to 8 other outward symptoms. So interesting statistic. We asked most frequent symptoms found in children who mouth breathe during the day and night. And you can see snoring, difficulty to listen, talks while they're sleeping. You can go down the list. So what are the implications of this study? Well, the findings show that sleep disorder breathing is much more common and affects children even as young as 2 years of age. We want to begin treatment as early as possible to ensure permanent changes. Identifying outward symptoms displayed in 90% of the children that enter your practice can significantly reduce this epidemic and enable you to successfully treat the overall health of your patients. And another interesting study that occurred was basically monitoring and identifying the brain activity in patients that have a normal night's sleep and those that are impacted by no sleep. So the first series of MRI images was on an individual that had a normal night's sleep. You can see the brain function. You can see the images of the red and the yellow. The second grouping of 3 images was on an individual that had 1 night of sleep deprivation. Wow, does that say it all? So interesting. Keep that visual in your head when you're looking at these kids. So let's talk about some other studies that have occurred and what they have found. So less REM sleep interferes with the removal of intercellular brain toxins, beta amyloid, reduces learning, judgment, reaction time, memory, and attention problems, dishonesty, and may also be linked to dementia and Alzheimer. So it's a very interesting study. If you haven't read it, I would suggest doing so. It is on our website. You're more than welcome to access it. Interesting study. So as a child, as a human being just walks around during the day, the brain cells are enlarged and basically toxins build up along, around or within the fluids around the brain cells. At night when we sleep, the brain cells shrink and those toxins are flushed out. Well, if we don't get into REM sleep, we don't have that process. And what happens? The toxins build up, and that's when we start seeing more and more of what they call plaque. And this plaque is found between brain cells in dementia and Alzheimer's disease. 3 consecutive nights of 4 to 5 hours of sleep can cause irreversible brain cell damage. This was out of a study at the University of Pennsylvania. Antibody levels increased 56% for each additional hour of sleep. 1 night of incomplete sleep can affect endocrine and immune system. That was done out of Harvard. Insulin reduces 40% after 4 hours of sleep for 5 nights. University of Chicago. Children 6 to 9 years old with less than 10 hours of sleep were 1.5 to 2.5 times more likely to be obese. Increased risk of type 2 diabetes. The effect on the immune system results in less resistant to infections, illness, and allergies. Sometimes you'll see these kids that have these issues miss a lot of school because of illness, have a lot of strep throat. We can talk about this, ear infections, things like that. Probably one of the most interesting and obviously epidemic proportions of the outward symptom of ADD and ADHD. We see the numbers rising. What I find so interesting is the number of children that are diagnosed with ADD and ADHD. Well, the medication that we use to treat this is 300% greater than the number of children that have been diagnosed. So what does that mean? Well, maybe it means that children that are diagnosed are on maybe three different medications to help identify or address this issue. Maybe a lot of are not documented as ADD and ADHD, yet they still medicate their children. Well, recent research has shown that 86% of the children with ADD and ADHD had sleep issues. That's horrific. But what's really interesting is obviously ADD and ADHD is an analysis that we make on a child. We have a list of criteria that needs to be fulfilled before that diagnosis or that label is placed on that child. Well, guess what? That list of criteria is the same criteria we use to evaluate sleep and breathing issues. So the question always is, maybe we should be evaluating sleep before we go down the route of medication or the label of ADD and ADHD. So there have been a variety of different studies. One of the largest studies done was Bonnick in 2012 on over 13,000 children. And there they found that sleep disorder breathing increases the risk of ADD and ADHD by at least 50%. ADD and ADHD patients have little or no REM sleep, but they have delta sleep. Patients without ADD and ADHD have primarily REM sleep and delta sleep. And in the research that we did, we found that ADD and ADHD is present in a little over 25% of the cases. A horrific statistic is those children diagnosed with ADD and ADHD, on average, 50% are held back 1 grade, 30% are held back 2 grades. Well, if it's sleep, I don't care. You can hold them back 10 grades. They're still going to perform the same way in school. So we need to be clear what we're addressing. And again, as I had mentioned, I think sleep should be evaluated first. Let's talk about bedwetting. Bedwetting is one of those unusual. When we start with the HealthyStart treatment, the stoppage of bedwetting can occur the very first night. It is kind of unreal that it can happen that quickly. So why is this bedwetting? No one's exactly 100% sure. The conversations have changed over the years. I assume they will probably continue to change until we can find a definite reason. But what the thought is, it reduces oxygen, the reduced oxygen, probably with a mouth breather, probably interferes with normal sleep. That eliminates or reduces the REM sleep, which we have talked about, and affects brain function and disturbs the endocrine and immune system. It results in bladder dysfunction, weight gain, insulin production growth, increased infections, etc. So they think it has to do with basically the balance of the body and the different systems involved, and that's the result. So the question, or maybe the answer is, if we can eliminate that reduced oxygen, and we tend to do that by eliminating the mouth breathing, encouraging the nasal breathing, we basically stop the bedwetting. So that's where the relationship comes into. So let's talk about HealthyStart and what these appliances look like and what we can do. So currently we have treated 4 million cases. We feel we do a very good job. We feel we have 51 years of experience. So we get great compliance from our patients. We have an amazing product. It is FDA cleared. Obviously, there's no latex, no plasticizers. All appliances are BPA free, BSA free, phthalate free, no silicone, and we regulate ourselves to a class 2 medical device. We don't need to regulate ourselves to that high of a level, but we want to do that. So you as a doctor, your parents that are providing this for their children understand our commitment to make sure that we have the safest appliances that are on the market. So what does the HealthyStart do? So we basically use a series of appliances to treat a child. The very first appliance will be what we call a habit corrector. And the habit correctors are designed. There are no 2 sockets in it yet. But what it is basically, it is an appliance that is going to address the habit. So it has the myofunctional therapy built into it. So we have the toddler, which is for ages 2 to 4, the kids 4 to 7, the preteen 8 to 12, and the adult age 13 or above. So if a child, when they walk into your office, say you have a child that is 5 years of age, you're going to use the kids form of treatment. So you're going to go through typically these 3 appliances during treatment. If the child walks in and is at 12 or 10 years of age, we're going to have them go through preteen. So they'll go through these 2 appliances. So with a diagnosis that we have done on each child, we will help you with the selection of the appliances, the timing, Basically, we provide a proposed treatment plan for your review. And basically, it goes through what we see in the case, different hurdles that might be there, timing issues, our concerns, what you should be aware of when you're treating. So it's that consultant that you have in your office. So what does HealthyStart do? It corrects, as we talk, these variety of different habits: tongue thrusting, mouth breathing, open bites, over jets, speech problems, narrow palate. These all are corrected by use of this appliance. And how does that happen? Because we have that myofunctional therapy built into the appliance. So the tongue is elevated to the roof of the mouth. The tongue tip is behind the rugae. Teeth parted with 3 to 4 millimeters of freeway space. Slight spread of the tongue interocclusally, meaning that we are going to put pressure in order to create and get extended expansion of the case. We're going to create nasal breathing, and we're going to basically allow the child to develop and to create a lip seal when they are wearing the appliance. Abnormal tongue resting posture includes tongue in the lower arch, obviously causing mouth breathing. The tongue tip between the incisors, causing what we call a tongue thrust. Lip posture, lips parted, basically encouraging mouth breathing, and open bite. So each one of these appliances has this myofunctional therapy built in, and that's how we're going to basically gain that correction. We also want to see exactly where the tongue is positioned. So you might ask, how do we do that? An easy way to do is to see the swallow of a child. So give them a glass of water. When a child swallows, you should only see the neck muscles move. If they are swallowing improperly, when they take a sip of water, their lips, their muscles all act to do the swallow. So you'll see movement of the lips, movement of the cheeks, and you'll know that the tongue is in the wrong position and the swallow is incorrect. So the design of these appliances have been designed specifically to create that myofunctional therapy. There is a ramp that actually lifts the tongue, puts it in the proper position. There are these prongs here that prevent the tongue thrust. It also tells the patient when to retrieve their tongue. We have these different shields. Doctors call them all ninja wings, all sorts of things for the kids to play with. But it basically is used to put pressure by the tongue. As we flatten the tongue, we're going to put pressure against those tabs, and it's going to create the expansion and the start of the expansion. We're going to use eruption of teeth also to gain expansion that we need. We also will, if we have an open bite, we'll add pads to them to help close that bite. We also have tabs on the lower to prevent the lower chin from drifting back if the mouth opening occurs. We do know at the beginning of treatment, it is sometimes more difficult for a kid to hold the appliance in their mouth because they are mouth breathing. So if we see it tumble out, we know that we have a mouth breathing situation that we're going to have to overcome. So the first night they'll wear it, maybe it stays in 2 hours. The next night we'll continue, maybe it'll stay 2 hours and 15 minutes. So we have to build it up. As we say, this is not a race. It's not a sprint to the finish line. We all get to the finish line, and it's just how your body reacts and how well your body assimilates this new appliance in their mouth. We have to eliminate the habits. If a child's older, the habit's been ingrained longer, so it's more difficult to break that habit. As we talked about, this myofunctional therapy is activated by a swallow. During the day, we swallow 2 times a minute. During the night, we swallow 1 time a minute. So if a child just passively wears this at night, we basically repeat that habit or that myofunctional therapy almost 500 times per night. So it is an unbelievable, you can kind of rest assured you're getting the myofunctional therapy. And when is the most important time for that therapy to be occurring? When the child is sleeping. So what do we look for? We talked as your child or as the patient's walking into your office, what are you going to be looking for? Obviously, you're going to be looking for an anterior open bite. You're going to look for a tongue thrust, improper swallow habits. You're going to look for an excessive overjet with minimal overbite, flared upper incisors. You're going to look for thumb and finger sucking, so the teeth gapped open like that. Sometimes you see a large separation in the lower incisors. Also constricted maxillary arch. Remember I told you pacifier, mouth breathing, tongue sucking, all those things create that suction and restricts that arch. Mandible displaces to one side, showing a crossbite. Lower midline to the right side or to the left side. This one happens to be to the right side. Lingually inclined lower incisors. Tendency is possibly a thumb sucker. Large freeway space, lateral tongue thrust, extreme overbite. Various other problems. A rolled lower lip. I can already tell you. Guess what that occlusion is going to look like? Deep overbite, deep overjet. So what the appliance can do, you can see after 11 months, and you can see what it looked like even after retention. So we're going to look at both scenarios. So we're not going to individually identify and treat. So we're not going to do an overbite and then we wait 6 months, a year and a half, whatever, and then do the next. All of it happens at the same time. And we get approximately 1 millimeter of correction per month. So if they have an overjet of, say, 7 millimeters and they have an overbite of 6 millimeters, take the largest inconsistency or problem, and that would have been the overjet at 7 millimeters. We expect this case to basically finish out in 7 to 8 months. So it's relatively quick what happens. Take a look at this patient. Remember we talked about, look at that profile. A rolled lip, we already know what's going on. But more importantly, let's take a look at their set. Look at this. You see a constricted airway. Look at what happened after treatment. They went from 3 millimeters to 10 millimeters. Quite significant, and that's just with use of the HealthyStart appliance. So let's quickly go through some case selection. I know it's getting a little bit late, but here's an interesting patient. This girl, actually her mother had jaw surgery because of an excessive overbite and overjet, and did not want the same for her child. The child came in, obviously you can address, you can see the rolled lip, you can see, look at the double chin, you can see the deep overbite, you can see the lack of a profile. So look at the interorals, you can see that deep bite, teeth are coming in, ideal. So they went through the HealthyStart treatment. So here she is. I don't know how much time changed, but you can obviously see the dramatic changes in her profile and her facial characteristics. Look at her dentition. Now let's see how well it retains. So here she is later, as an adult. You can see how well the case maintains. Here's another child, wore the appliance for basically, I think it was a year and a half, maybe close to 2 years. You see the deficiency. Look at the mouth, open mouth breather, actually, which she was also a thumb sucker as well. Wore the appliance, look at the improved profile. Look at the case. We went from a huge overjet, overbite, and you can see her in post-retention. Here's an 8-year-old. You can see in a year, you can see the dramatic changes that occurred. Again, only with HealthyStart, nothing else. Mandibular advancement. You can see it happened in a little less than 2 years. You can see the dramatic change. Here is he post-retention, 25 and a half years of age. This is the frontal view of that same case. You can see the profile changes that occur. Here is a patient, a little bit older than we like, 12, boy. Sometimes boys mature a little later, so we have maybe a little bit more opportunity to capture some growth and development. But you can see what happened in this case, less than 2 years. It's pretty dramatic. Actually, this patient was not a good patient. We wanted him to wear it more during the day, maybe an hour to 2 hours exercising, because he had a lot of permanent teeth we had to move. He did not want to do that. So he would put denture powder into the appliance and stick it in his mouth and just sleep with it. So this correction happened with only nighttime wear, which is remarkable. I don't suggest trying that on every patient. I think exercising is really an important key that helps move the teeth more rapidly, but also eliminates pain that's caused with tooth movement. HealthyStart can straighten teeth without wires or brackets. These cases straighten out pretty quickly. This probably happened in probably a month or 2. Here's 12 months in Healthy Start. You can see the changes that occurred. This is an interesting way to understand. So as the permanent teeth are erupting, the appliance basically captures the tooth and directs it into a proper alignment, putting natural pressure on the adjacent teeth in order to create the expansion to allow the tooth to erupt in straight. So you can see what the result looks like. So anyways, I think we have a couple questions here, and I'll be more than happy to answer them. Susie, I don't know if you're on.
I am. Yes, yes. Thank you so much. And yet there is actually a great question, probably one of your favorites. It's from Dr. Myers, and he's asking, how do you get a 2 to 3 year old to wear the appliance?
Oh, awesome. Believe it or not, we conducted one of the largest orthodontic studies, and it was done in Finland on hundreds of children, and we actually watched them for 15 years. And so we basically have little techniques. I mean, we talk about what the appliance looks like. Maybe you compare it to a pacifier. It is soft, it's squishy, it feels good. Sometimes I refer to it as a pillow for your teeth. So we usually talk about it. We'll give you all sorts of guidelines. We want to give you little tricks of trade for patients to be more compliant. But I tell you, the first one is just their curiosity to see how in the heck this is going to feel. So we talk about it being soft and squishy. I always have them touch it, feel it, squish it in their hands. And usually as I'm describing it, before I even finish my spiel, that thing is in their mouth. And I'll say, so what does it feel like? Does it feel better than the pillow on your bed, or is it something different? And I never had a child that didn't tell me it feels squishy and good and like a pillow for their head. So that's one way. That's my way. We have a variety of different ways. But what's important is the study that we had done in Finland, they actually measured compliance, and we got 94% compliance out of the entire gamut of those patients. We redid that study to see the compliance out of Tufts University, and again, the exact same percentage. So I actually think our percentage is probably higher now because we've gotten so much smarter and clever in the way we help with compliance. So yes, I have no worries. A 2-year-old, a 3-year-old. Sometimes I will say, if we're looking at a very, very young child, our youngest patients are actually 13 months. I think to date we have 6 or 7 of them that are 13 months. They need to be mature enough to hold something in their mouth. But I do tell parents, you know, sometimes we don't give our kids enough credit. We say, oh, no, my child, there's no way they could do it. Well, how do they put a pacifier in their mouth? How do they hold that in their mouth? Sometimes I see kids putting their fist in their mouth or their foot in their mouth. Well, it's all the same thing. If you can give them something that's fun, it's something that makes it interesting for them, and most importantly, it's going to make them feel better. So as we progress through treatment, we usually find that our patients don't like to give up the appliance. When we tell them that the treatment, we are done, most of the times they don't want to give that up. They are worried they're going to go back to what they were feeling before, and they want to continue. So maybe we have a different problem as the kids get older, but I really wouldn't worry. As a young child, it's really easy. And as I say, it is a lot of fun. Healthy Start is just a great treatment all around. It's a win-win for everyone. And your staff will love it. We try to get staff's family involved. It's a great system, especially for the young kids.
Right. And the other thing that's awesome, I mean, I know we're talking about little ones here, but even for the older kids, I mean, we have so many amazing tools. So every single child who is a Healthy Start patient actually receives an app. And so it's fantastic because they get rewarded through this app for wearing their appliance. So the parent clicks that they wore the appliance, they earn game time in a game zone, and only 30 minutes, so it's not like they're on their phone all day or anything like that, but it's just 30 minutes where they can have fun and have this reward for wearing their appliance. They even earn a coin that they can actually use after they've earned so many coins. They can actually use in a merchandise store. And then the app is great as well because for our doctors, our parents can connect directly through the app with their doctor. And so they can take real-time progress pictures, and as they're taking those progress pictures through the app, it'll fall right into the back end of our doctor's portal, because every one of our doctors actually has their own personal portal as well. So anyway, we do a lot of really neat things for not only our patients, but also our doctors and even our parents, so that everybody can connect and really have a successful experience. So just thought I'd mention that too.
And I'll have to say, the app has been a great adjunct, and the kids seem to have a ball with it. It's absolutely adorable. It's a town. It's a Healthy Start town. They go to the different buildings. It's great fun. In fact, you can actually go on the Google, on the Apple Store, and download the app free of charge. Now, it's only open on certain buildings in the town, because it's more of a tool for a parent to find out a little bit more about Healthy Start, what it entails, and get a list of providers and find one that's close to them. So there's additional benefits to that app besides just for our patients.
Yeah, absolutely. Absolutely. So if it's okay, I'm going to share my screen really quickly. And let me see here. I'd like to take a few minutes, and of course, if you have any additional questions, please do not hesitate to ask. I'll keep my eye out on the Q&A, so if there's any that come up, I'll have Leslie address them. But I wanted to tell you guys a little bit about our digital education platform. Our digital education platform has been the most exciting thing I think that our doctors have experienced. Every doctor who joins it been fantastic for them, and we really open it up not just to our doctors, but also to all of the staff members, because we want everybody in the office to understand Healthy Start, understand what's going on, and once you start working with these kids and you already have an idea, you know that these kids need help, you want everybody involved. So we actually started a new program, and it's called our Digital Education Series. And we had a digital class that actually just started a couple of weeks ago. It's a totally online series, which is great because it gives our doctors the opportunity to watch it on their own time. And so typically what I'll do, it's a 6-session series. And so what I'll do is every Monday, I'll send out a new series. So the series, like for example, the first series is over sleep disordered breathing. The second series is over oral habits. The third series is over facial growth and development of dentition, and so on. And so every Monday I send out a new series. Every Friday, we actually have an interactive live study club. And even, for example, Dr. Bergerson, who is the founder, the owner of Orthodontics by Healthy Start, the inventor of this system, he actually, we're so excited, but he actually, every once in a while, we have him come on and he mentors our doctors who are a part of our digital education course. And so he's actually going to be on tomorrow, and he's going to be the mentor teaching the study club, which is really cool. The study club is live and it's interactive. So we invite our doctors, we invite all the staff members to join, ask questions. We talk about practice integration. We talk about medical billing and dental billing and just all kinds of different things, because again, we want you to be successful. We talk about marketing and how to take it out into the marketplace, how to talk to the parents. We talk about your website even, how do you get your website to create landing pages on your website so you can let parents know what you're doing, things like that. One of the fantastic things about this course is that it's hands-on. And what I mean by that is we actually give you 2 entire cases with the course. And I'm talking full cases, everything from all of the appliances that you would need for those 2 patients, the diagnosis, the animal cases, the app, plus 24/7, basically 24/7 customer care. So anyhow, we all of that is included in the course. The interactive study, because we also have a forum. So we invite all of our doctors to join a forum, and the forum, we actually have provider mentors and staff members who are monitoring the forum pretty much, again, 24/7. And so when you're asking questions on there, we try to come back with answers for you pretty quickly. But we have doctors who are posting pictures and asking questions, how does this case look? And so everybody kind of learns from each other, which is really, really cool. 18 CE credits is what you earn for this course. And by the time you're done, you are certified as a Healthy Start provider. So you can actually offer Healthy Start in your offices. Not only that, but you are now trained on how to assess and, of course, treat children who have these issues. This is a course that actually complements the new ADA policy on sleep-related breathing disorders. And this policy actually states that it is the responsibility of every oral physician to assess these children, assess airway. And so we offer the opportunity to do that through this course. And actually, the ADA took this course, and they said it was ingenious, which is very high praise. So we have doctors from all over the world who actually attend this course. And I want to tell you a few things that some of these doctors are saying. We get testimonies pretty much on a daily basis, but here's a few. So this is a doctor from Australia. He said that our digital course was excellent. All at Healthy Start have really got their act together and offer resources others strive for but rarely achieve. Well organized, passionate, and supportive. I have a doctor from Canada. He said, I want to thank you and your colleagues for this amazing course. I've been searching for a solid system to help my patients, and this is by far the best, most organized, comprehensive course I have taken. And then a doctor from Colorado. I have really enjoyed the course. We have identified quite a few patients that will benefit from Healthy Start. My business partner's 4-year-old is in the habit corrector because he has had swallowing problems, and we have already seen great improvement in his eating. We already have 3 more patients ready and who'll be starting next week. That's actually what we hear more often than anything. I mean, we have doctors who are just 2 to 3 weeks into this course. And I mean, they already have patients that are lining up at their door because, they're using those 2 free cases, maybe on staff members, maybe on their own children or their grandchildren. And so they are seeing the significant changes that are happening in these kids' lives. They're seeing the straight teeth with as Leslie was saying, I mean, it happens so quickly. And the symptoms of sleep-related breathing disorder, I mean, the symptoms it's amazing when they're breathing right and they're getting the right oxygen into their system and you see these changes occur. It's just amazing. So anyhow, so they, it really, word kind of basically spreads like wildfire, and pretty soon you have parents knocking down your door because they want to get in. So how do you get involved? Couple different ways. The first is you can either call or email, of course. 844-KID-HEALTHY is our office phone number. You can also email contact@thehealthystart.com. I have down at the bottom, as you can see, now is the time. We do, because as I mentioned, this course did start on July the 9th. Not a big deal. I mean, I can get you caught up very, very quickly. So it's not a problem. I can send you everything to get you caught up and get you ready to go for actually tomorrow. Because tomorrow is our first would be your first interactive study club. But we do have a course starting in September as well. But the reason I'm promoting this course to you guys is because right now is the perfect time. Our Healthy Start doctors are the most they're the busiest. This is their busiest time right now through September, October, busiest time. And the reason is because parents are wanting to get their kids screened before school starts. I mean, this is a big deal. If you think about the fact that these kids are going into school, and if parents realize that this is going to help them to perform better, their grades are better because they're getting better sleep. A lot of these kids are being diagnosed with ADD or ADHD on medication. And of course, this is the answer. The medication is just a Band-Aid when the real problem and the real root cause of the problem we can address. So anyhow, so it's just the perfect timing. And again, even if they are assessed and everything is great, it's still peace of mind for their kids. But this is something that is so important right now, and the parents are getting it. And we do a ton of promotion, and we help you promote. So anyway, so the back to school it's a big deal, which is why I'm really pushing. If this is something that you're wanting to get involved with, now is the time. So we actually are offering a promo. If you jump on our website, openairwaydentistry.com. We have you can register online electronically. It's all secure serve and all that good stuff. And we'll email you, or not email you, sorry, we'll physically send you a welcome package, which will have your first 2 appliances in there. So you'll have your starter appliances. So those 2 kiddos that you're thinking about, you can get them started on those habit correctors immediately. And then, of course, we'll take you through the rest of the case on how to submit the rest of their case so that you can get the rest of the appliances that they need for their case. But if you sign up electronically, and you have a limited time to do that, we will honor a $200 promo for you. There is a little, there's one of the fields that asks for a discount code. The discount code is webinar, being that you're on the webinar. So just type in webinar and that will give you that $200 off. But if you have any questions, please contact me. You can reach me at Susie@HealthyStartChild.com if you have any additional questions. We do have destination courses as well. One of the things that I failed to mention earlier is that with this, you'll also get a $3,000 voucher to actually attend any one of our destination courses, and along with 4 of your staff members. So you really can't beat it. I mean, it's return on investment immediately with this course, which is really awesome. And, it's all about helping the kids. And that's really why Leslie has set this program up the way that she has, why she's made it such a deal for our doctors, giving you the cases, giving you the vouchers to attend the courses, is because it's about the kids. So anyhow, I wanted to tell you guys about that. Again, if you have any questions, I do see there's a question that's up here. Let me click on it real quick. Okay, I will absolutely, yes, let you know how you can get signed up. Dr. Myers, so if you'd like, you can email me and I can give you additional information that way. Or as you can see, if you'd like to go on to openairwaydentistry.com, you can actually sign up online and then we can send you everything that you need. So whichever way is better for you. It is totally fine with me, but if you'd like to email me directly, I can send you everything you need to get you signed up as well. Okay, so CE credits. Let's see here. So your CE credits will actually be emailed to you within a couple of days. But if you have any questions or, if there's anything that you need at all, you can either, as I mentioned, you can reach out to me directly, Susie at HealthyStartChild.com, or you can email the office at contact@TheHealthyStart.com. Or here's our number. And you can actually screenshot this if you'd like, and that way you have all this information. So I'll leave that there for just a second. And then I'm going to click back up to this one, and you can actually screenshot this as well. And that way, again, you have all of this information as well. So Leslie, is there anything else that you'd like to add? I know I went over a ton of stuff, and I'm sorry if I went through it so quickly, but if you guys have any questions, please ask.
Well, I just thank you all. I know it was a lot of information, but I think it's so important, and I appreciate you staying a little past 9 o'clock. But if you think of something, sometimes things come to our head, please don't hesitate to reach out to us. Please visit our website. We are always looking for questions that come about. Please reach out. Take us up. We have a lot of information that's available, research articles, sleep questionnaire. And obviously, I would basically implore you to get started. Start tonight. School is starting, back to school. It is an ideal time. Our busiest time of the year is September, and it all stems with back to school. So if you have the opportunity, start now. If you can join the July, get caught up, it will be a great experience for you. You'll treat those cases and you'll be all prepared for back to school. So with that being said, thank you, Susie, for all your information and your help. And I wish you all a good night. And tomorrow's the first day that you're going to start looking at those kids differently and start evaluating their sleep, their breathing, and their airway. So thank you for joining us.
Thank you so much, Leslie. Thank you, everybody who was on tonight, and have a great rest of your week. I guess tomorrow's Friday, so have a great weekend.
Take care. Bye-bye.